My name is Ogooluwa Olufemi. I am a final year medical student and an advocate against gender-based violence. One of the things that was the highlight of speaking in this event is seeing in real time the audience receiving the message, especially even other members of the panel. It was very intriguing, especially the first session when we had a conversation about intergenerational gap, and I could see that other members of the panel were actually listening and receiving the information. So I think as a speaker at this event, it was a very great experience seeing that, okay, as I was speaking, people were actually listening and they understood what I was saying. So yes, it was a great experience. One thing that I really picked from this event is the inclusion in information. We didn't just come here to speak about just one thing. There were so many things. We spoke about sexual and reproductive health. Even in sexual and reproductive health, we spoke about different aspects. We spoke about gender-based violence. We also spoke about mental health, adolescent health. I like how holistic it was. The highlight was learning new things about different things. There had some things I had not even heard before. I heard about them today. It was an enlightening moment. And one other thing that I really picked up was listening to projects, people presenting abstract, and I was impressed, I was encouraged, I was motivated especially as regards gender-based violence. A lot of people are putting in work, the projects being done especially in local communities. So that was a very, very motivating factor for me, because as an advocate and one who goes into local communities to advocate against gender-based violence, it was encouraging to see that there are other people in different communities doing the same. So yes, those were my highlights of the event. Okay, one thing that I know that this is going to help me with, I have been equipped with knowledge to help me understand better how to approach problems that I'm going to be faced as a doctor and also as an advocate. Because now I'm being taught about holistic healthcare, about different areas. I've learned a lot about so many Federal Ministry of Health statements and sections that have been put out that I didn't even know about. So being aware is going to help me as a healthcare provider to be able to provide healthcare services that are all round. And as an advocate, I'm not coming from a myopic point of view. My experience and my knowledge has been expanded. I would say 8. And it was excellent organization. One thing I saw that I was very impressed with is the collaboration. It was as if they had the exact and perfect people to come in. UNFPA, we had UNICEF, we had the collaboration was strategic. I need to say that was very impressive. And even in the content of the events, we had panel sessions, we had speakers, we had people present posters, we had abstracts. It was all round excellent. Lagos is still but anyway, if I say the Southwest, I'm going to be partial. If we want to be inclusive, we'll say somewhere in the North. If we want to be inclusive, somewhere in the North. But to be selfish, I'll say Ogun State. Come to Ogun State.